Now, to other matters. The International Day to End Obstetric Fistula is celebrated on the 23rd of May, and that's to create awareness on childbirth injury resulting from prolonged and obstructed labor. According to the United Nations Population Fund, obstetric fistula occurs annually, leaving women with leaking urine, faeces, or both before and after birth, and often leads to depression and social isolation. 90% of pregnancies involving fistula end in stillbirth. This year's theme, Breaking the Cycle, Preventing Fistula Worldwide, underscores the urgent need to address obstetric fistula comprehensively, emphasizing equitable access to quality maternal health services, social reintegration, and sustained investment in healthcare systems. For more on this health condition, gynecologist Joel Akonde joins me here in Lagos for a deeper look into obstetric fistula. Thank you so much for joining us, Dr. Akonde. Considering you are a gynecologist and, a fertility specialist, I'd really like us to talk about this and to look at whether this condition has a direct impact on the ability of a woman to conceive on one hand and then to carry the fetus to term.
Good afternoon. Thank you for having me. Glad that you have brought up this topic. Yes, this topic is very important in terms of gynecology and fertility. Unfortunately, it affects fertility. It can actually cause infertility because the woman is isolated, the reproductive system is damaged, and there is infection. All of these can seriously impact the ability of the woman to conceive. Even though it is in its original form, it is conception that gave rise to obstetric fistula. A fistula in the sense that there is a hole that links the vagina area of the reproductive system to the back passage, otherwise called rectum, or the front side, which brings in urine out, as well as the bladder. So the woman may have reluctance to have sexual intercourse, may be isolated, may be infected, may also have difficulty in conceiving, or even at all. In fact, she may even not have periods at all subsequently.
They all just really seem to be against, someone who has this condition. But what can we as a community, as a people do to encourage them, and what kinds of help are available to them?
Well, we have to go to the root causes of obstetric fistula. Like I mentioned, obstetric fistula is when the woman has hole that links the vagina to the back passage or to the front tissues. Now, it is due to obstructed labor, prolonged labor that stays too long, or labor that is not progressing, is obstructed. And then the baby has to come out somehow, and therefore, there is tissue damage, and the whole system links each other. As a result of this, the causes we have to look at are, number one, the age of the woman at the time of pregnancy. Usually, they are under 20. In Nigeria, about 54%, at least more than half of obstetric fistula is due to age-related issues. The woman is under 20 by the time she gets pregnant. As a result of that, this whole physical infrastructure of the woman is immature. So we need to address that. The other one is poor healthcare access, poor access to healthcare, poor access to medical care. If you're going to address obstetric fistula, we need to address care for the woman who is pregnant, who is delivering. Then you have other issues like access to construction roads, accessibility in terms of physical infrastructure. Then you have poverty, malnutrition, that these women are poorly nourished. By the time they get pregnant, the baby takes a lot from them. And as a result, they too, by the time they are in delivery or about to deliver, they are poorly prepared. As a result of this, the tissue are vulnerable and not able to withstand the pressure of delivery. But principally, 97% or thereabout of obstetric fistula may be due to obstructed labor and prolonged labor.
All right, let's talk about
So education is very important. Education is very important. Access to medical care is very important, as well as taking care skills of the obstetricians and medical care during labor.
All right. So I was going to talk about treatment for this condition. Yes, it's good to sensitize people ahead of time. These are the things to take note of. Watch out for a certified health facility where you should have your child, and all of that. But then for people who already have this condition, what treatments are available to them? How accessible is it and how affordable is it?
Well, there are various estimations, and let me quote in dollars because of our fluctuations in our currency rates against international currency. Now, it varies between $300 to $3,000. It depends, individuals, but in some facilities, it can be as low as $300, and in some, depending on the complications and what has already been damaged, it can be as high as $3,000. Convert that to Naira, and you begin to see the magnitude of the problem. $300 in our currency as it is, $1,000 is about, as of today, maybe around 1,400 or 1,400,000. And then you are talking of about 300 to 400,000 Naira. You already have fistula, you're already poor, you're already malnourished. Where are you going to raise 400 to 500,000 Naira to repair, not to talk of $3,000 to repair obstetric fistula. But it's doable if you concentrate on the issues. About 30,000 women every year develop obstetric fistula in Nigeria, and we have the highest in the world. About 40% out of 2 million in the world are in Nigeria. So it's a national emergency that we need to tackle to improve the welfare and the well-being of our women.
All right. So what is your charge now, to government, to civil society organizations on managing the situation, and also to women of childbearing age?
Well, all hands must be on deck. Everyone is involved. The education of the woman is the primary thing. She needs to know thyself. You need to know yourself. Well, unfortunately, some of these women are committed to adult relationship as early as 13, 12, 10, and they are still children by world definition of being a child, and they don't have a say in some of these things. So, but education, that said, culture has to change, education has to improve, and that is for the woman herself and the immediate society. But in terms of medical care, all hands must be on deck, at national level, at state level, at local government level. NGO has to come in. Perhaps, if I may say so, international organizations need to also help us. But it is our problem. So it is our fundamental problem, and we need to address it and not push it as a buck to somebody else. So state government, local government, NGO, and federal institutions need to come into this.
This has been a very robust conversation. Thank you very much, Dr. Joel Akonde, gynecologist and fertility specialist. I hope some other time we can, have more on this topic. Thank you so much for talking to us.
Thank you very much.